way through, then you can cut the guide off. Mallet this part into the bone, and then from there you're going to flip the button and retro ream your 20mm tunnel. Once you've done it, back into the joint. The little buttons on the side here makes the drill back in a straight line and out, and that's your femoral tunnel done. And then, as you can see in the video, you can see that big hook that sits at the back, and at that angle, it's got quite a bit of space to protect the that's the structure. So I normally set this at 60. Put the guide back in through your portal, hook it over the back, squeeze up to bone. You're going to drill through, I won't go through all of it, but you're going to drill through, take the guide off, retro ream, full tunnel, all the way out, and then we're going to pass our graft. In passing the graft, I'm just going to cheat here and use this. I'm just going to hold this up to the camera, so you can see. You can see here, there's the button coming up to the graft, just like we had in the video. We're going to pass this through. Normally your lateral cord. Okay, so in passing the graft, we want to just be pulling on the blue and white striped sutures and just bringing the rest of the sutures along with us. So we're coming through the portal into the socket that comes out. Now at this point, when you're pulling, you'll feel it pop as it comes out through the tunnel. Okay. At this point, once you feel it pop, then pull back on the graft side. And we often get asked the question, how do you know if you're actually on bone? If you lift and pull back and just toggle like this, you'll feel it tapping on the bone. And when it's tapping on the bone, that's a good sign. So once we've flipped it, then all we need to do now is just shorten the loop. So we go for the white strand with the blue tag, pull the white strand, and as you pull it, keeping counter pressure on the graft. So counter pressure on the graft and just pulling, it's like a seesaw as you shorten the loops on the graft, on the button I should say. And at about that point, we're locked off. Okay? Once we're happy that we're locked off, and we put a lot of pressure on here to make sure that that's locked, taking any slack out, then we'll have our sutures to shuttle. And then we can drop the sutures through and pull that graft through the tunnel and then bring it through and dock it. Okay, once we're happy with it docked, then we take our button. The button, as you can see in the video, it's like a W shape. There's a little dot on the back that goes to the bone. Well, then just overhand knots, 5 overhand knots. To lock the sutures on. And 5 overhand knots, and then that's done. We just trim the suture here. We can take the retensioning suture and cut that off. Pull the blue and white striped suture out, and cut the tensioning sutures. We have a suture cutter, we have scalpels in the lab, but not here. Can, but normally we just get a Lang and Beck, push it up against this here, just to shorten it, and then just dock the sutures, the tensioning sutures on the femoral loop. So that's what we're going to be trying to achieve in the lab. We will also have some meniscal repair stuff, and